So my topic today is on Chinese herbal medicine. Firstly, very briefly, I introduce myself. My name is Shen. I graduated from Shanghai University of Chinese Medicine in 1982. And after my graduation, I was a Chinese medicine doctor in China, in Xinjiang, very far away from Shanghai, for not for very long, for 2 years and 8 months, and then I decided to take further training. So my second degree in Chinese medicine was in Beijing University of Chinese Medicine from 1985 to 88 as 3 years post-degree training. And then I stay in Beijing in the same university to teach Chinese medicine until 1995. That's the year I moved to UK to practice Chinese medicine. And also I start my teaching in UK in 2005. It's an acupuncture program in Lincoln University in England. Around the same time, I start my teaching in Shenzhen as well, 2005. So now it's about 15 years. Okay, Chinese medicine. We're talking about Chinese herbal medicine here. It's an integrated and important part of TCM. TCM means traditional Chinese medicine. Chinese herbal medicine is based on the same theory and diagnostic method with acupuncture. Basically, I think Dr. Tan just mentioned about the teaching structure in Shenzhen. The first year is the foundation of Chinese medicine. And then the following 2 years, students can choose acupuncture or Chinese herbal medicine. So you can say the foundation year, doesn't matter you want to go for acupuncture or herbal medicine, the foundation year is the same, you learn the same thing, because the theory, the diagnostic method, syndrome differentiation, and so on, they are the same to acupuncture and to Chinese herbal medicine. Yeah. And Chinese herbal medicine has a history as long as acupuncture. We don't know exactly how long, but yeah, as long as acupuncture does, if not longer. Yeah. And the Chinese herbal medicine also accounts for the major part of TCM, which is the truth, as I said, being used to treat a wider range of diseases. We're talking about the application of Chinese herbal medicine in China now. In China, Chinese herbal medicine actually is more popular than acupuncture. Herbal medicine is used to treat more different diseases than acupuncture. This is historical reason, of course. So that's why we say actually Chinese herbal medicine is more popular than acupuncture in China. I try not to deny acupuncture is also good, but herbal medicine in China is more popular. I think the reason simply because for many conditions, Chinese herbal medicine can be more effective, like skin conditions, TCM dermatitis, gynecology conditions, and many internal medicine conditions, and so on. Of course, acupuncture can be much better for pain-related conditions, back pain, joint pain, and so on. Yeah. So just try to visualize what we do in Chinese medicine practice. Doesn't matter herbal medicine or acupuncture. This is what we do in our practice. Yeah. When we see a patient, first thing we do is consultation. Yeah. Within the consultation, we need to do case taking, asking questions, check the pulse, check the tongue, and so on. And to do this kind of practice, we need our TCM theories. And very often in modern time, we need medical knowledge from Western medicine as well. And then next thing we do is, to analyze the clinical data from the patient, the clinical manifestations of the patient. We need to analyze. The purpose for this analysis or collection of the data is to set up TCM diagnosis, or very often we call syndrome differentiation. All this kind of thing, from this case-taking, medical knowledge, TCM theory, to TCM diagnosis differentiation, actually covered in foundation year in Shenzhou. Yeah, so first year, doesn't matter acupuncture students or herbal medicine students, they learn the same thing. Only come to second year and third year can be different. This is because, in our practice, after the consultation, after our analysis, diagnosis, we give treatment to our patients. And only come to treatment, you can choose acupuncture or herbal medicine or tena massage and so on. So this is the difference. And then here depends on the patient's condition, of course, and sometimes depends on the patient's choice, and sometimes maybe depends on the practitioner's preference. And then you can give acupuncture or herbal medicine or something else. And sometimes maybe you choose both acupuncture and herbal medicine together. So I saw some pre-questions by some applicants asking, what should I learn first, acupuncture or herbal medicine? I think actually doesn't matter which one is first. Foundation year is the same thing, yeah. And then from the second year, you choose to learn acupuncture or to learn herbal medicine. I think in Shenzhou, the fact is most people choose to study acupuncture first. And after graduation from acupuncture, some of them, they want to widen their scores of practice, try to treat more different patients with more efficacy, effectiveness, and then they decide to take herbal medicine course. I think that's the situation with most students in Shenzhou. So how to learn Chinese herbal medicine? As I said already, basic knowledge on Chinese medicine theory, diagnosis, including syndrome differentiation, is always needed. And actually you learned from the foundation year already. And in year 2 or herbal medicine year 1, you learn basically 2 subjects. First one is individual herbs. You learn the herbs one by one individually. And the second subject is herbal formula. It's herbal prescriptions. This is different from Western medicine because in Chinese medicine, Chinese herbal medicine, we always use the formulas, which means it's a multiple ingredients with combination of many single herbs. Normally it's 12 to 13, 14, yeah, it can be more single herbs combined together, mixed up together to form a herbal formula. And the herbal formula can be ready-made into herbal products or can be tailor-made individually to your own patients. And in year 3, it's called herbal medicine. Year 2, you do the clinical subjects. You learn the clinical diseases, and each clinical diseases, you learn how to treat this kind of disease by Chinese herbal medicine. Again, based on syndrome differentiation. Yeah. So really, with individual herbs, with herbal formulas, we learn Chinese herbal medicine by functional categories. Of course, there are many different categories or different classifications of herbal medicine. Doesn't matter single or formula. And we classify the herbal medicine into different categories. Yeah. So of course, classroom teaching, classroom study, and combined with home study with practice, and practice alongside the classroom study. So really, in our lectures, we do a lot of case discussions, and also actually do practice on real patients. For acupuncture lecture, for herbal medicine lecture as well. I think it's the similar thing. Sometimes we invite students to bring some real patients to the classroom for this purpose. Home study is always needed, of course, yeah. And then apprenticeship organized, arranged by Shenzhou. In this part, I'm not involved, so I can't talk into details. So you may have questions to ask how many herbal individual herbs and how many herbal formulas do we need to learn? Well, here I gave you the whole picture of Chinese herbal medicine education in China. So the first line you say, TSM universities in China, they teach over 500 individual herbs and nearly 200 herbal formulas. And they spend a lot of time, of course. Yeah. In Western countries, actually, we don't need to do that much because a lot of herbs are hardly used. Some herbs can be toxic. We never use them in Western countries, in Europe. And some herbs, maybe due to different legal systems, some herbs are not legal in Europe, and so on. So in our practice in the UK and in Europe, in Netherlands, we use normally 200 to 250 herbs, single herbs. So in our teaching, normally we teach about 200 herbs. Yeah, 200 herbs. The formula, less than 100 formula, mostly common, popular formulas. Yeah, about 90 formulas. In Shenzhou, you can see in herbal medicine year 1, you have 10 weekends. So altogether 120 hours. It's quite a lot. It's actually more than the hours, actually more than the TSM courses in the UK. You know, in the UK, a few years ago, there are quite a few universities offering TCM education. That was proper, degree courses, BSc degree level, yeah. And in Shenzhou, actually, you spend more time than the degree course in the UK. And I don't know how much time left for me. And I just quickly go through some examples on simple herbs and on formulas. This shen is ginseng in English. Yeah, I think everybody have heard of this. Yeah, very expensive and very popular herb. It's a #1 tonic, yeah, herbal medicine, Chinese herbal medicine. Very good to invigorate qi and reinforce qi and tonify spleen, lung qi, and so on. Even for some rescue treatment, for some people with in shock state, in Chinese medicine, maybe something like a collapsing syndrome. Yeah, qi, blood collapsing, yin yang collapsing, and so on. Yeah, you can say in Chinese medicine, herbal medicine course, we go into details to learn the functions and the clinical indications of ginseng and how to use it, the dosage, the application, the caution as well. Yeah. And another single herb, I choose Da Huang as an example. Actually, it's a rhubarb root, maybe different species of rhubarb, but rhubarb in Europe, people use it as vegetables. But in Chinese medicine, we use the root. Yeah. And this is the most well-known and the most well-researched detoxifying herb. Try to get rid of toxin from the body. And it has such purgative purpose to move the bowels for constipation, clear heat, reduce fire, for heat syndrome, and clear heat, remove toxins for toxic heat syndrome, and cool blood, stop bleeding, and clear heat and the joint damp for damp heat syndrome, and so on. Yeah, a lot of applications. Of course, we can't go to details. And recently, certainly a nature product become popular, resveratrol, a natural health supplement. And this is a kind of chemical compound and acting like antioxidants, protect the body against cancer, against heart disease, and so on. And a lot of nature products made of this ingredients and IT engine and so on. But the source of this chemical actually mainly from a Chinese herbal medicine called Fudang, Polygonum caspitatum. Yeah, it's a Chinese herbal medicine. Yeah, this is the herb. Yeah, this is the herb. In Chinese herbal medicine, we say it's a function, clear heat, remove toxin, expel wind, joint dampness, dispel blood stasis, and relieve the pain, and so on. And recently, COVID-19 outbreak, and the Fudang is one of the herbs become more popular, more well-known, because it's effective in treating this virus. Yeah. Finally, I just give quick example on herbal formulas. Yeah. For example, this one, 麻杏石甘汤, and only 4 ingredients. And this one was created by Dr. Zhang Zhongjing 1800 years ago in his famous book, Shanghan Luan. I think some herbalists, already qualified herbalists, you must have heard of this book. And Dr. Zhang Zhongjing, very famous. And his formula, 1800 years ago, now is popular one to treat COVID-19 again, because it's effective, simply because it's effective. Traditionally we use it to clear lung heat. And the modern application, you can see respiratory conditions, viral, bacterial or viral infections causing pneumonia and so on. The studies has confirmed this formula has such pharmacological functions, protect the lung, improve the oxygen density in the blood, and reduce the inflammatory reaction, and so on. I don't go to details here. So some scientists already did such study on this formula. So that's the evidence why this formula can be effective in treating the COVID-19. Maybe not directly to kill the virus, but to stop the damage to the lung caused by the virus, or at least reduce the damage. Another formula, 玉屏风散, and also popular in recently. And this formula, Chinese people use it for prevention of COVID-19. Of course, the prevention of other infections as well. Basically, in traditional language, we say it's tonify qi and stabilize or consolidate exterior, the body surface. And in modern language, is to improve our immune system to prevent infections, especially viral infections and so on. Again, you can see very simple formula, only 3 ingredients. So that's all my presentation.